people we spoke to confirmed that the issue exists in the health sector. All he told me was that the medicine he had prescribed could cause stomach issues and inquired if I usually have them, after which he prescribed another medicine to counter the stomach problems and said I should return if the issues persist so that he can change the medicine. My baby was born premature at 5 months and 3 weeks, and he had to be incubated. During the night, a needle was inserted into his arm for intravenous purposes to give him medicine. But when I woke up, the arm was completely swollen. I was alarmed and called the nurses, but they told me it was not my concern. They then removed it and started speaking in English among themselves, thinking I would not be able to understand them, saying I would be given a transfer. When I asked what it was for, they said it was not for me, although I could use one tool, seeing that my baby's condition was not good. They waited until it was too late, and my baby went to surgery only to lose his arm. With such cases coming to light, calls are therefore increasing that patients should be adequately briefed, and some of the health experts we spoke to said patients should even be able to choose which doctors care for them, though this can be difficult because of a shortage in the health sector. The head of Rwanda's Medical Association has gone on record to say that when doctors withhold information from their patients, they are breaking the rules, and people have a right to report such incidents to the association for follow-up, and that includes all other forms of malpractice as well. Law experts reiterate that this is a legal right. The law provides that right, that citizens should have access to such health services and that they can choose which doctors treat them and the way in which they are treated, as well as the hospitals that provide the services. Minors and others unable to make such decisions can have representatives do it on their behalf. Doctors must provide all relevant information about the treatment procedures and the consequences that could result before seeking what they call consent. In addition to this, patient-doctor confidentiality must be maintained, and the law does hold that doctors can be legally liable for any malpractice during the treatment process.